Hello students, welcome back, and in this video lecture we are going to talk about blood group. Let's talk about the genetics of the blood group first. Blood group ABO, which we know either the person is having A blood group, B blood group, AB blood group or O blood group. This system is known as ABO blood grouping system and it was given by Landsteiner. Then for determination of a blood group, the one person is having A blood group or B blood group. This identification of this blood group is because of the H chromosome, H gene that is present on chromosome number 19. So H gene is a gene that is present on chromosome number 19, and because of this gene that is present on all the blood groups, we can tell that person is having this particular blood group. So genetics, if you see of the ABO system, then it is a H gene that is present, and this is present on chromosome number 19. So A blood group, B blood group and O blood group. See, this is H gene that is present on chromosome number 19. If they ask A is present on which chromosome, it is present on chromosome number 9. Just remove one. B blood group, it is present on chromosome number 9. O blood group, it is present on chromosome number 9. Or AB blood group, it is present on chromosome number 9. And RH blood grouping system, we say either the person is B positive, B negative. So this is RH compatibility. RH is either positive or negative. So RH blood group is on chromosome number 1. So just split the chromosome number 19 into 2. 1 is plus minus, that is RH system, and 9 is AB, all these blood groups that comes in the alphabets. So H gene is present on chromosome number 19 and H gene is present on all these blood groups. So H gene act as the fucosyl transferase. So H gene act as the fucosyl transferase and adds the H substance to the particular blood group. So H gene is going to add this fucosyl molecule to N-acetyl galactosamine, then it becomes A blood group. If this fucosyl molecule adds to the galactose, then it becomes B blood group. If this fucosyl molecule, see, H gene act as the fucosyl transferase. So it is because of this H gene. If fucosyl molecule adds to the N-acetyl galactosamine, then it becomes A blood group. If this fucosyl molecules comes and adds on the galactose, then it becomes the B blood group. If the fucosyl molecule adds on both of these, it adds on N-acetyl galactosamine as well as add on galactose, that means it is going to be A B blood group because A and B both are present. If fucosyl molecule does not add to any of the molecule, then it becomes O blood group. So based on this, basically what is the function of this H gene? This H gene is going to add the fucosyl, it is going to transfer the fucosyl molecule. So it is fucosyl transferase. So H gene is going to transfer the fucosyl molecule. If this H gene transfers the fucosyl molecule to N-acetyl galactosamine, then the person has got A blood group. If the H gene adds the fucosyl molecule, transfers the fucosyl molecule to galactose, then it becomes B blood group. If it adds on to both, then it becomes AB. And if this fucosyl molecule does not add to any of the molecule, then it becomes the O blood group. As the name suggests, 0. It is not adding to any of the molecules, so that makes it an O blood group. You can remember it makes it a 0 blood group. So the maximum conversion of the fucosyl molecule, because it is adding to N-acetyl galactosamine as well as galactosamine, so there is very less of the H gene, very less of the fucosyl molecule left. So the least H substance is present on AB blood group because it is consumed by adding to N-acetyl galactosamine and galactose, so it is not left. So least H substance is present on AB blood group, while on the other hand on O blood group, this fucosyl molecule is not adding to any of it. That means we have plenty of fucosyl molecule, we have plenty of H substance. Maximum H substance, this is least H substance, that is on AB because it is consumed by attaching to N-acetyl galactosamine or by attaching to the galactose. While on the other hand, for O blood group, this fucosyl molecule is free. It is not binding to any of the molecule. So we have plenty of fucosyl molecule, plenty of H substance present. That means maximum H substance is present on the O blood group, right? So maximum is present on O blood group because it is not attaching to any of it, and we have plenty, we have lot of fucosyl molecule present. While on the other hand, least H substance is present in AB blood group. Why? Because most of the substance is converted into something else. It is attaching to N-acetyl galactosamine as well as to the galactose. How do we test the H substance? We use Eulex lectin and we have anti-H antibodies that are required, and on that we do the calculation for the amount of H substance we have. I have already told you the least H substance is present on AB blood group. Maximum H substance is present on O blood group. So the maximum is present on O, least is present in AB blood group. We go from maximum to least. So A blood group has got A1 and A2. That is why we have written this maximum H substance, O, then A2, then B, then A2B, and then A1, and then A1B. This is how the H substance concentration is there. It is calculated using this testing by Eulex lectin and anti-H antibodies. Now coming to blood grouping system, very easy to remember. Whatever the blood group is, the same thing is going to be antigen. If it is A blood group, then it is going to have A antigen. If it is B blood group, it is going to have B antigen. If it is AB blood group, it is going to have both A as well as B antigens. If it is O blood group, O means 0. It is not going to have any antigen. O antigen means no antigen. Again, I'm going to repeat the same thing. A blood group means A antigen. B blood group means B antigen. AB blood group means A and B both antigen. And O blood group means no antigen. Now, what we have recalled from our microbiology or pathology classes is that antigen binds to antibody and there is going to be a reaction. So we do not want this reaction in the body. So A antigen is not going to have anti-A antibody. If the person is going to have antibody against this antigen, then the person will not have any blood. That means blood is going to kill its own blood type, right? So this kind of person is having anti-B antibodies. That means if you transfuse this B blood group to A blood group person, this anti-B antibody is going to destroy all the blood group B thing, right? So that is why we have the other opposite thing. If the person's blood group is A, antigen is A, antibody is going to be anti-B, right? If the person blood group is B, antibodies are going to be anti-A. If the blood group is AB, then we want both of these antigens, right? So there is not going to be any antibody against it. If the blood group is O, there is no antigen. That means antibodies both are going to be present, anti-A antibodies and anti-B antibodies, right? So antigens are going to be same for blood group A antigen, for blood group B, B antigen, for blood group AB, both of these A and B antigen, and for blood group O, there is no antigen. So in each of these blood groups, H antigen is common. It is present in all the blood groups. H antigen is present in all the blood groups. All of them have H antigen. None of them will have antibodies against it, right? So we have H antigen presenting in all the blood groups, that is ABO blood grouping system. Now let's talk about the different other blood grouping system. The first one we have in the other category is Bombay blood group system. Bombay blood group system is not having any A antigen, no A antigen, no B antigen, no B antigen, or any other antigen. But see, if you remember blood group O has no antigen. See, this is the blood group O, it has no antigen. But this Bombay group, we cannot say it is a O blood group. Why we cannot say it is a O blood group? Because in O blood group, H antigen is present, while on the other hand in Bombay blood group there is no H antigen also. H antigen is also not present. So that is what we call this person as Bombay blood group. This Bombay blood group is identified by a group of scientists that is known as Bombay, and it was discovered in the Bombay. That is why we call it Bombay blood group. So Bombay blood group is a special class of people. They in the hospitals, they have a list of people who are having Bombay blood group. They do not have H antigen, they do not have A antigen, they do not have B antigen. There is no antigen, not even H antigen is present. No A antigen, no B antigen, or any other antigen. And it's not even O blood group because it does not even have the H antigen. And it has therefore anti-H antibodies. Why? Because there is no H antigen, therefore antibodies against it are present. What is the universal recipient that we say? Universal recipient in the blood group is AB blood group. AB blood group is the universal recipient. Why we call this universal recipient as AB? Because there are no antibodies in the plasma for these blood groups. If there is no antibody, see, this is the AB blood group, there is no antibody presenting in the AB blood group, and therefore they can receive any kind of blood. They can receive A blood group also, B blood group also, and they can even receive O blood group also. So to these people you can give any kind of blood. That is why we call them universal recipient, means they can receive. Recipient means receive any blood group. Universal donor, that donor means it is going to donate, right? It is O blood group. O blood group can donate to any of the person. Why? Because there is no antigen present on the O blood group. When no antigen is present in the O blood group, that is not going to react. And because of this reason, the safest blood group for transfusion in emergency, a person comes in the hospital in emergency and you do not have time to check the blood group. There is a lot of blood loss and patient is barely surviving. In that case, your main concern is to survive the patient. For that, we are going to give O blood group, which is the universal donor, because no antigen is present in this blood group. So to this person, you are going to give O blood group, because there is no antigen present on the O blood group and you do not have time for the blood group test. The safest plasma, if you are giving for the transfusion in emergency, plasma means you are going to give plasma that does not have any antibody. Which blood group has no antibodies? Remember, antigens are same. No antibodies means it is the EB blood group that has no antibody.